Surgical Guide of Suprapatellar Tibial Intramedullary Nail. One, patient position. The patient lies supine on the radiolucent surgical table, ensuring that the knee joint of the affected limb can be bent up to 10 degrees. 2. Determine the length and diameter of the main nail. Under C-arm fluoroscopy, place the developing template above the tibia of the affected limb and read the required diameter and length. 3. Approach. With the knee in full extension, make a 2 cm longitudinal incision on the skin 2 cm proximal to the upper edge of the patella. 4. Open the medullary cavity and expand the medullary cavity. Assemble the porous guide needle sleeve, protective sleeve and protective sleeve handle. And stick them to the bone surface along the incision. Drill a 3.2 threaded guide needle through the porous guide needle sleeve. If the position or angle of the guide needle is not ideal, keep the previously inserted guide needle and implant another guide needle in the porous guide needle sleeve. Remove the porous guide needle sleeve and use the proximal opening reamer to open the hole. After the hole is opened, remove the threaded guide needle. 5. Reset. Use the reset rod to reset the fracture site. Then insert the ball head guide needle. 6. Medullary cavity expansion. Connect the reamer to the soft drill, then to the quick change handle or electric tool, and rotate the reamer clockwise to expand the tibial medullary cavity along the ball head guide needle. Use the reamer in turn from 7.5 to 12 millimeters. 7. Implant the main nail. Take the main intramedullary nail of appropriate length. Use a T-type hexagon wrench to fix the connecting bolt and the main intramedullary nail on the suprapatellar access handle, and push the main nail into the medullary cavity through the suprapatellar access handle along the ball head guide needle. Install the tapping rod and tap gently with a slide hammer to assist in the insertion of the main nail of the intramedullary nail. Then confirm the position of the main nail of the intramedullary nail with fluoroscopy. Remove the tapping device and the ball head guide needle. 8. Remote positioning. Install the distal guide rod and determine the hole position of the distal guide rod and handle according to the selected length of the intramedullary nail main nail. Lock it with the guide rod bolt. Insert the positioning rod drill sleeve and positioning rod trocar through the distal guide needle channel until the drill sleeve reaches the bone cortex. Remove the trocar. Use the positioning rod drill bit to drill into the platform position. Use the positioning rod flathead drill to remove the residue in the hole, and remove the positioning rod drill sleeve. Insert the positioning rod and clamp it with the positioning block. Insert the threaded connecting rod sleeve and the positioning rod drill sleeve through the adjacent channel. Use the positioning rod drill bit to drill into the platform position. Remove the positioning rod drill bit and positioning rod drill sleeve. Insert the distal threaded rod and the distal guide rod for threaded connection, and then clamp it with the positioning clamp. 8. Remote locking. Install the distal sight and the distal guide rod on the inner side of the distal tibia and lock it with the guide rod bolt. Insert the locking screw protection sleeve, locking screw drill sleeve, and locking screw trocar through the distal sight channel in sequence. Remove the locking screw trocar and use the 4.0 locking screw drill bit to drill through the cortical bone to the opposite side. Use the same operation to complete the insertion of the other locking screw hole. Remove the locking drill bit and locking drill sleeve. Measure the drill depth with a locking depth gauge and determine the screw length. Select the required length of locking nail, connect it with the hollow locking nail screwdriver, the screwdriver core, and the quick change handle, and screw the locking nail into the locking nail protection sleeve. Use the same operation to complete the implantation of the other 2 locking nail holes. Nine. Proximal locking. Remove the non-implant instruments and keep the suprapatellar access handle. Install the proximal sight on the handle and lock it with the proximal sight bolt. Insert the locking nail protection sleeve, locking nail drill sleeve, and locking nail trocar through the dynamic locking hole channel, and complete the implantation of the first proximal locking nail in the same way as the distal locking nail implantation. Insert the compression screw along the end of the connecting bolt, and use a T-type hexagonal wrench to rotate the compression screw clockwise to compress the fracture end. After the compression is completed, keep the compression screw and complete the implantation of the other 3 locking nails in the same way. 10. Tail nail implantation. Remove the proximal sight, compression screw, and suprapatellar access handle. Select the appropriate tail nail length. Connect the ball head tail cap screwdriver and the straight quick change handle to implant the tail cap. Suture the wound to complete the implantation of the suprapatellar intramedullary nail product.